Liana with Los Gatos Orthopedic Sports Therapy here, and this is Bella. Yes, hi baby girl. This is Bella. She is 12 and a half years old, and she's got some pretty gnarly arthritis in her back, hips especially. We've actually been told that maybe she could use a total hip replacement or two, but with her arthritis and with all those things, it hurts, right? Figured I'd take this opportunity to maybe let you guys know a few things that you can do, there she goes, that you guys can do if maybe you have hip pain too. Maybe you're choosing to self-quarantine, maybe you just don't have the time or the accessibility to come into the clinic, but just want to take an opportunity to give you a few little tips and tricks that you yourself can be working on. Hip pain, obviously, disclaimer, this advice and tips don't replace the medical advice that you receive from a direct provider. So whether that's a physician, a physical therapist, whoever, seeing somebody in person is going to give you the best idea of what's truly best for you. This is not meant to diagnose. Obviously use with your own discretion and ask your therapist or your doctor if you have any questions. So a couple of exercises that you can quickly work on yourself. Obviously, if any of these hurt, I would not suggest you continue with them. They're just a general guidance. So the first is just an easy bridge. So you're gonna bend your knees, bringing your heels closer to your bum. The further out they are, the more you're gonna work your hamstrings. The closer in towards your tush, the more you'll bias the glutes. You are gonna work both. You're gonna squeeze your tush, keep your core nice and tight, and lift your bottom straight up towards the ceiling. You can hold that up there for 20 seconds, get those glutes really engaged and that core tight, like I said. Don't let that back arch. Keep everything nice and in line so you're getting it to engage on the glutes and the hamstrings, and then slowly lower down there. You can do that a number of times. Get that to fatigue out in those muscles. Then you can also make it a little bit more challenging if you need by adding a march. So we're adding a march here, or making it a single leg bridge. Getting that one side at a time, making it more challenging. Obviously, if those progressions are too difficult or if they hurt, I wouldn't suggest that you do those. The other muscle, so that one was for the gluteus maximus, so your big glute muscle. This one's more for your gluteus medius. Those are the two main muscles that we're going to focus on. So that Jane Fonda in the 80s was onto something. You lay on your side and do that leg lift. Looks familiar, right? That's gonna hit that gluteus medius nicely. If you are uncomfortable in this position, I'll show you another modification of it here in a sec. Make sure your hips are nice and stacked. You're going to lift that leg straight up towards the ceiling and slowly lower it down. Don't let it kick forward because you'll engage a different muscle group that we don't want to use. So I want to make sure that that stays in line with your body. If it's hard to figure out where that ought to be, you can put your butt up against a wall or the back of the couch and slide your heel up and down. Make sure not to go too far. Don't want your hips to roll backwards there. All right. In this same position, bend both knees. We can do a clamshell exercise. So you're going to keep, again, those hips nice and stacked. You're going to lift your top leg up towards the ceiling and slowly lower it down. All right, up through there. That's too easy. You can add a little bit of resistance there by putting a band around your knees. Same exercise here, up and down. You can even add that to the leg lift if you wanted to as well. If it's too challenging or uncomfortable doing those on your back, you can do them laying on your side. You can do them laying on your back by sliding out like a snow angel here, or pushing out with the clamshell here as well. It's working those muscles. All right, so getting those muscles nice and strong is going to be really important for taking the load off of the hip. We look forward to seeing you guys back in the clinic as soon as possible. We encourage you to hit up our website, maybe utilize our telehealth visit option. We do have that capability, and that's a really good choice to check in with your therapist, ask any questions, review your exercises. I know these are uncertain times, but we're here to help and support you in your health as much as we can.